Hello, this is Dr. Sanabria, a neurosurgeon from Memorial Hermann. I specialize on glioblastomas. Glioblastomas are tumors that arise from astrocytes. Astrocytes are the star-shaped cells that make up the glue-like or supportive tissue on the brain. These tumors are usually highly malignant because the cells reproduce quickly and they are supported by a large network of blood vessels. As you can see on this picture, an astrocyte consists of a star-shaped form. All of these little things right here, these branches that are coming off, these are the things that are connected to the network of blood vessels. And this is why astrocytes are very dangerous if they get out of control. This is the MRI of a person who has a glioblastoma on the right frontal lobe of the brain. As you can see, there's a huge mass right here. And this mass consists of the overproduction of astrocytes put together, thus creating a huge tumor that will spread throughout the whole brain. And sadly, it terminates the life of the patient eventually because all of these little astrocytes are going to keep overproducing and interfering with the actual functions of the brain. As surgeons, we strive to remove as much of the tumor as possible without damaging certain areas of the brain needed for vital functions, such as sight, the ability to speak, move, or other things. But many high-grade tumors have grown tentacle-like pieces that invade tissues extremely difficult to reach in the operating room. If the tumor's location prevents complete removal, then the surgeons will at least attempt to reduce the tumor size by excising a piece of it. With radiation therapy, I would plan the course of treatment to kill tumor cells without injuring too much left of the leftover healthy tissue. Radiation usually entails multiple sessions, ranging from 10 to 30 treatments. Radiosurgery uses computerized calculations to focus radiation exactly to the tumor to minimize exposure to the rest of the unaffected brain. Chemotherapy is another treatment method, but the overall survival rates for patients with advanced brain tumors do not increase drastically with these options. Doctors often give their pediatric patients chemotherapy instead of radiation to minimize any lasting effect on the developing brain. Also, not everyone can withstand chemotherapy side effect, so the patient's team of doctors will need to conduct a thorough evaluation of the patient's overall health and strength. To improve survival rates, researchers have been continuing to experiment with gene therapy, with highly focused radiation as well, and immunotherapy. We are doing a lot of research right now, but it is really hard to work with glioblastomas, considering that they are in the brain, and it is hard to remove them without actually cutting a really important part of your brain in the process. Alright, thank you for watching, and I hope this video has been educational for you.